All right, in today's morning rounds, a study in the Journal of the American Medical Association finds a link between high blood pressure and dementia. About 1 in 3 American adults have high blood pressure. Dr. Tara Narula joins us with what you can do to stay healthy. Good morning, Doctor.
Good morning,
Nice
Anthony.
to see you. What is the connection to begin with?
So dementia affects about 10% of Americans over 65. We don't have a lot of great treatments or preventive measures. And a lot of people don't know that hypertension or high blood pressure can be associated with future risk of dementia. And this is something that's potentially modifiable. And dementia being one of the most feared conditions for American adults. So this particular study looked at about 4,800 Americans and followed them over 24 years. And they looked at blood pressure patterns, and they found 2 patterns that were associated with an increased risk of dementia. The first was when you had high blood pressure in midlife, which is 50s to 60s, that persisted into your later life. The second pattern was if you had high blood pressure in midlife, but then developed very low blood pressure in your later years. And by low, I mean less than 90 over 60. And so all of this really, again, highlights the fact that hypertension is potentially modifiable. We can really make a huge public health impact by controlling this. We need to be starting this early in your 40s and 50s. And as far as the older population is concerned, we do need to kind of do more research to figure out what is the ideal blood pressure when you get older that we should be targeting.
Yeah, what is the answer to that? And what can you do to control your blood pressure?
Well, there's a lot you can do. And so first of all, you have to start getting screened early. We actually tell people in your 20s you should start getting screened. You should know what your numbers are, have that very close relationship with your doctor where if you do have high blood pressure, you're getting checked often. If you're prescribed medications, please take them every day as prescribed. Yeah. And then there are a lot of lifestyle things you can do. So we talk about reducing salt in your diet, increasing potassium, exercising, controlling your weight, limiting alcohol consumption, quitting smoking. So lots of things that are in your hands to control your blood pressure.
You mentioned your doctor monitoring blood pressure, but there are tests for at home. I also see in the drugstore they'll have that little thing you put your arm in. Are those reliable?
They can be. We do prescribe those or tell our patients to use those because they help us monitor how well they're being controlled at home or what their pressure is at home. Because for a lot of people, when they come to the doctor's office, for example, their pressure is very high, they're nervous or anxious, and then at home it's a little bit lower. And also if you're on treatment, it gives us a sense of how well you're being treated. So one thing you can do is, get a monitor, even bring it into your doctor's office and compare it with the pressure they're getting in the office to see how accurate it is.
Why is high blood pressure, Tara, considered a silent killer?
This is such an important point. High blood pressure is asymptomatic for a lot of people. You feel well, and so you think, I don't really have high blood pressure, or maybe I had it one time, but now I'm fine. I don't need to take my medications. But what it's doing is it's damaging, that increased pressure is damaging all the blood vessels that supply blood throughout your body. And this is why it's associated with an increased risk of chronic kidney disease, stroke, heart attack, heart failure, vision loss, sexual dysfunction. I mean, anywhere there's an artery in your body that's seeing high pressure, there's potential to damage those cells.
All right, Tara, you've inspired me to get tested and find out what my number is. Thank you very much. We appreciate it.